there. My name is Dr. Mad. Very nice to meet you. How are you doing today? Okay, I see. You are in the right place. I'm going to definitely give you a very thorough checkup. But first, let's see what kind of exam you need. Can I please have your first and last name? Perfect. And your date of birth, please. Perfect. Do you have any allergies? Okay. Are you allergic to any foods? Tomatoes? Okay. Any medical history that I should be concerned of? Okay. So you had an eye surgery. How long ago was that? 12 months ago. Any residue symptoms related to that surgery? Okay. Do you have any hypertension, hyperlipidemia, anxiety, depression, any kidney disease, headaches that don't go away with medication? Okay. Any pain anywhere in the body? And on a scale of 0 to 10, how would you rate your pain right now? Okay. And how would you describe it? As intermittent? Is it constant? Dull? Okay. And can you please show me exactly where the pain is? Any accidents in the last 12 months? Any ER visits? Okay. Did you have any broken arms or broken bones in your lifetime? Okay. And do you have anybody in your family with any of the diseases that I mentioned? Okay, and that's your father. Okay. Perfect. Are you taking any medications at the moment? Okay. How many milligrams of that? One time a day? Okay. Perfect. I believe I have everything I need. And what we're going to do today is cranial nerve exam. I'm going to focus on your eyes specifically. Also, I'll do a very thorough head checkup, make sure that your sensitivity is on the normal level. Do you have any questions for me before we begin? Okay. No worries. I will be very gentle. And in the meanwhile, just let me know if I'm not doing something right and I'll try to correct it. Can you please tell me today's date? Okay. And who's the President of the United States? Very good. What is 3 plus 1 minus 2? Wonderful. Can you please tell me your birthday again? Okay, perfect. I'm gonna go ahead and take your oxygenation and your heart rate first. This is going to go on your index finger. Perfect. Okay, so just take a deep breath in and relax. I most definitely don't want your heart rate to be elevated, falsely elevated. Okay. Your heart rate is 89 beats per minute. Your oxygenation is 96 percentile. That's perfect. Okay, very good. Any flu-like symptoms in the last 24 hours? Okay. I'm going to take your temperature. Is it okay if I put it underneath the tongue? Perfect. So go ahead, give me a big ah. Good. Okay. 99.1, which is perfectly normal. Did you have any coffee or any warm liquids before coming in? That might explain it, definitely. So what I'm going to do right now is I'm going to check your head. Also, I do have a special comb that, allows me to better visualize the scalp. Let me know if you feel any kind of pain. But first I'm going to start with very light palpation. Is it okay if I palpate your head and also just make some movements with your head? Okay. Well, let me know if you experience any kind of pain, if you feel any kind of tingling sensations around your spine, down the spine, or right here under the occipital lobe. Okay, perfect. So go ahead and relax. I'm just going to come a little bit closer. Just feeling behind as well. Any pain there? Okay. Palpating behind your ears, your mustard bone. Okay. That is symmetric. I'm not feeling any lumps. You're saying it hurts right here. Okay. I'm going to make some movements with your head, so just relax, please. Okay. Good. Okay, I'm going to go down your neck. Any pain? Your shoulders. And behind your neck. Any pain there? Okay, good. Is it okay if I check your scalp for any parasites infestation? everything looks very good. I didn't notice any lice or any dandruff, although that's what I thought I saw. And you're not complaining of any pain. I'm gonna go ahead and just slowly palpate your face. Let me know if you feel any kind of pain. Good. Okay, I'm going to go ahead and just palpate both sides. Any pain there? I'm going to palpate your jawbone. Any pain? Good. Okay, I'm going to palpate for any lymph adenopathy, which is lymph enlargement. Relax. Perfect. I'm not feeling anything. Okay. I'm going to start by examining your ears first, since that is what you're concerned of. And let's see, what do we have here? Okay. First thing, I'm going to just inspect your ears. Okay, make sure that they are both symmetric. Okay, I'm not noticing any lumps. There's no redness and there's no discharge. Okay, good. I'm going to insert some drops in your ears. This is going to allow me to better visualize your ear canal. Okay, so just relax for me, please. Good. I'm going to insert one more drop in your left ear. Perfect. I'm gonna go ahead and just slowly approach you and take a look inside the ear canal. Perfect. Okay, wonderful. So I'm definitely able to see the ear canal. Tympanic membrane is intact, dull gray, no redness. I'm not noticing any cerebrospinal fluid. No signs of infection. Let's go ahead and check your other ear now. Okay, perfect. Your canal is clean. Tympanic membrane has margins very well defined. Color is pearl gray. Perfect. No discharge, no signs of infection. And most importantly, there is no cerebrospinal fluid, which is perfect. Okay, I would like to check your hearing. Make sure that there's no fluid behind the tympanic membrane. Okay, so what I'm going to do is I'm going to check your hearing with a tuning fork. Have you ever had one of these tests done before? Not your first time. Okay, so I'm going to create the vibration sound that you're used to. And please tell me when you don't hear the sound anymore. No? Perfect. Let's go ahead and do the same thing on the other side. Now, okay, great. The next test, I'm going to place the tuning fork in 2 different positions, and please tell me which position here is louder for you. So this is position number 1. Good. And this is position number 2. Definitely number 2. That's a very good sign. Perfect. This is position number 1. And this is position number 2. Definitely number 2. Wonderful. Okay. Let's go ahead and check your sensation behind the ear, which is right here, the mastoid bone. So what I'm going to do is I'm going to touch you with an object, and can you please tell me where exactly you feel it? Okay. Perfect. Same thing on the other side. Close your eyes. Okay, perfect. Okay. Go ahead and check your vision now. Do you have a problem with bright light? No? Okay. Well, I'm going to ask you to follow the light with your eyes only. Don't move your head at all, okay? Perfect. Good. Okay. Yes, I'm definitely checking your eye movement, and very soon I'm going to check your peripheral vision. Good. Okay. I'm not noticing any strabismus. Good. Eye deviation, no change in your pupils. And you don't seem to be in any discomfort while following the light, which is perfect. Okay. What I'm going to ask you to do now is to look right here at my fingers. Perfect. And now look at the light. Good. Look right here at my fingers. Okay. Now look at the light. Good. Look right here at my fingers. Perfect. Now look at the light. Good. Look right here at my fingers. Good. Now look at the light. Perfect. Okay. Can you please Look right here at my nose. Keep on looking at my nose. Perfect. Good. Can you please look up? Good. One more time. Look up. Perfect. Now can you please look down? Good. Keep on looking down. Wonderful. Can you please tell me what color this is? Wonderful. What shape is it? Good. What color is this? Perfect. Okay. So what I'm going to have you do is follow the triangle. And now focus your vision only on the light and follow the light and tell me what shape I'm drawing. Perfect. Okay. Can you please tell me when you don't see the light anymore? Now, good. Okay, keep on looking at the triangle. Good. Tell me when you see the light. Now, perfect. Okay, keep on following the light. Good. Can you please look this way? Good. Now look the other way. Perfect. Let's go ahead and check your peripheral vision. Look at my fingers right here. Perfect. Now look at my fingers right here. Good. Tell me which fingers are moving, right or left. Good. Perfect. Perfect. Good. 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 Perfect. Excellent. Good. Yes, I'm not moving them. Good. Wonderful. Perfect. Good. Good. Perfect. I'm going to go ahead and cover one eye. Can you please tell me how many fingers I'm holding? Wonderful. Great. Perfect. I'm going to do the same thing on the other side. Please tell me how many fingers I'm holding. Good. Good. Perfect. Okay, and while we're here, tell me when you see the light in your field of vision. Now, good. Now, good. Now, perfect. We're going to do the same thing on the other side. Tell me when you see the light in your field of vision. Now, good. Now, good. Now, perfect. Now, perfect. Tell me when you don't see my fingers in your field of vision. Wonderful. Perfect. Good. Good. Same thing on the other side. Tell me when you don't see my fingers in your field of vision. Good. 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 Perfect. Okay, good. Okay, I'm going to keep this at a certain distance. Can you please read this word for me? Box. Perfect. And time. use. That is too easy. Dog. Perfect. Okay, so I believe this is a good distance. Let's go ahead and check your shape perception. Can you please tell me what shape this is? Very good. What shape is this? Very good. What shape is this? Boat. Perfect. What shape is this? Heart. What shape is this? Now it gets harder and harder. Star. What shape is this? Perfect. What shape is this? Good. Okay. This is called the Snellen chart. And I'm going to ask you to identify two letters that are written here. Can you please tell me first what color this is? Red. What color is this? Green. Perfect. And what shape is this? Good. What shape is this? Same. Perfect. And do you see them equal in size? Good. Can you please tell me what letter this is right here? Oh, good. What letter is this? L. Perfect. So let's go ahead and read the last row, starting with this letter. L, D, F, B, H. Good. Can you please read these numbers right here? 2, 3, 4, 5, 6, 7, 8, and 9. Which circle is bigger, 2 or 9? It's obvious, yes. Number 9. I'm gonna go ahead and check your pupil size now. I was able to notice that they are equal in size, reacting to light and accommodating, but I just want to make sure that when I shine a very bright light in your eyes that they don't dilate too much. Good. Good. Okay. Okay, so it's perfect size. Wonderful. I'm gonna go ahead and check your nerves now, your ocular nerve. So what I'm gonna do is I'm going to come very close to you and shine a bright light in your eye. Please try to not look at the light. So go ahead and look right here behind me on this wall. Good. Okay, perfect. I'm not noticing any scratches on your retina. Everything looks very clean. No signs of infection, and the ocular nerve is intact. Okay, let's go ahead and check your other nerve now. So keep on focusing right here behind me, okay? Good. Perfect. Not noticing anything abnormal in this eye either. Looks very intact. Can you please look up for me? Good. Look down. Good. Look to the side right here. Okay. And now look the other way. Perfect. Okay. Can you please close your eyes I'm going to check your facial sensation. Okay, tell me where you feel this. Good. Where you feel this? Perfect. Did you feel that equally on both sides? Okay. Where do you feel this? Wonderful. And what about now? Excellent. What about now? Good. And what about now? Okay, so facial sensation is intact. Can you please smile for me? Good. Now frown. Puff your cheeks. Keep them puffed for me, please. Wonderful. Can you please open your eyes as wide as you can? Good. Now close your eyes and don't let me open them. Perfect. Can you please shrug your shoulders just like that? Good. Strong muscles. Can you please push with your tongue inside your cheek? Good. Push with your tongue inside the other cheek. Perfect. Okay. Can you please give me a big ah? I want to check your uvula and your tongue for symmetry. Good. Good. See ah. Okay. Very good. Gag reflex. Good. Okay. Uvula is midline. I'm not noticing any enlargement. Pink and moist. Excellent. Okay. Let's go ahead and check your smell and your taste. So the first thing that we're going to do is I'm going to check your smell buds. Let me go ahead and just shake this really well. Perfect. Okay, go ahead and cover one nose, one nostril. Can you please tell me what that smells like? Good. Smells like strawberries. Excellent. Yeah, as I know that you're not allergic to any fruits except for tomatoes, it's okay to do this. Okay, now we're gonna go ahead and check your other nostril. So go ahead and switch. Okay, go ahead and try to smell this. What does it smell like? Grapes. Perfect. Okay, one more. And now you can keep both nostrils open. They're definitely patent. I was able to notice that you are breathing in and out. No obstruction noted. Okay. Take a deep breath in. And can you please identify this? Good. Exactly. It smells like grass. Okay. Let's go ahead and check your taste buds next. We are using the same type of solutions, but now I'm just going to place one drop on your tongue. What does that taste like? Cantaloupe. Perfect. Okay. I do have one more. Okay, I'm gonna go ahead and check one more. Can you please tell me what that tastes like? It tastes like wine. Perfect. Okay, I believe I have everything I need. Let's go ahead and just make some notes over here. Intact. I'm gonna go ahead and send you for a CT scan of the head and neck because our cranial nerve exam today was absolutely normal and I wasn't able to see any abnormalities. Okay, here is your referral for the CT scan. What you have to do is to call this number right here, okay? And just make the appointment as soon as possible. But I don't think you have to go to the ER today. Sounds good? Okay. Thank you so much for allowing me to take care of you today. And I'll see you back soon.